how I can put this on my. Hi, it's a pleasure to be here. Thank you so much for the opportunity to come and share with you. I was just telling them that most of the time we are forgotten. We are out there at the vet school and nobody remembers that we exist. And everybody just thinks we do animal stuff, dog and cats, but we do so much more than that. So I'm going to share with you a little bit of the work that we've been doing the last few years. A little something about me. I'm from Kenya. Originally, still from Kenya, actually. Let me not say originally, because I'm planning on going back. And I did my veterinary degree. I'm a veterinarian. I did my veterinary degree at the University of Nairobi. And then I worked with livestock keepers in rural communities for a long time. And I developed an interest in international development with a focus on gender and community development issues. So I went on and did my master's in international development. So I sort of crossed over and went into social studies, kind of, which was really tough, I can tell you. It's very tough to go into a field that you don't have any background in. And so I did my master's in international development with a focus on gender and community development. Went back to Africa and for maybe a period of 10 years, worked in the area of development, especially with pastoralist communities in Kenya, Uganda, Eritrea, Southern Sudan, Ethiopia, across like 7 countries, but with a focus more on women, livestock keepers in the rural communities and how we can promote them and lift them up. And with the pastoralists who are already marginalized, just working with them to sort of bring them to a level of being recognized that their lifestyle or their way of doing things is actually probably more sustainable than what we want them to do. And then I came back and decided I wanted to do a PhD. And so I came to Tufts, to the veterinary school, and did my PhD in infectious disease. And I think one of the driving factors behind that was that when I worked in Southern Sudan, I worked in Southern Sudan at a time when there was a war going on for maybe I don't know if you know a little bit about the Southern Sudan war, for maybe 3-4 years. And I would find myself on the ground and I'd be the only vet and the only medical doctor and the only person on the ground who can really do. So I'd deliver babies and then I'd deliver cows. And then I would, so I was sort of really interested in infectious disease, and I thought some of these things that are crossing over, especially from humans to animals, might be a good area to focus on. So I came back to Tufts and I did my PhD at the vet school in infectious disease. We have a department of infectious disease that's actually very human focused. Everybody thinks everything at the vet school is veterinary, no, but we have our department of infectious disease and global health focuses on a lot of human diseases. So after I finished my PhD, I was very lucky because right at that point, the USAID RESPOND project was looking for a technical lead. And because I'd worked in development for a very long time, I got that opportunity to get involved with them. And so I got absorbed right away, and I've worked with them since then. Okay, that's just a little bit about me, and I'll go on to talk about the project. Feel free to interrupt anytime if you have a question, or if you want to wait until the end. It's up to you. Whatever you choose to do, I'm okay with it. I do want to say that this presentation was put together by me, but actually there's a whole team of people who've been working on this project. So I just want to acknowledge that right at the front. But specifically, I have one of the technical advisors that I've been working with in Africa, Dr. Diafuka. He's based in the DRC. So him and I were I was the technical lead for Africa for this project, and working with him specifically as the technical advisor from the Tufts part of it, and Professor Zipori, who's the PI of the project. He's still the current PI of the project, and those are the 2 people whose input actually I thought when I was trying to sort of put this together to share with you, and I will share a lot more about. Do I need to point it at something? All right. There we go. So when I was thinking about One Health, to me, it's sort of like building bridges, and I thought this is usually a good analogy for me. Like, people understand a bridge, that a bridge, you use it to cross from one place to another, and it creates connections. So we've been working in this area of One Health. It's not a new concept, and I'm sure you know about it, just that it's sort of all of a sudden come to the limelight, and a lot of people are talking about it, talking about One Health in different ways. But to me, when I think about it, I think about it as a way of building bridges. How do we bridge, especially with the current infectious disease outbreaks? And I'm focused on infectious disease because I work in infectious disease, so that's probably a big part of my life. But we know that a lot of diseases that are affecting humans, actually 75% of all infectious diseases are of zoonotic origin. They came from some wildlife or animal or that, and vice versa. We have a lot of diseases that are coming from humans to animals. And if we're just doing the same thing that we've been doing for the past 20 years, medical doctors are doing their thing, vets are doing their thing, environmentalists are doing their thing, we will not get anywhere. But if we start thinking together and working together and acknowledging, it's not necessarily me as a vet training to be a medical doctor, but me acknowledging that I do need an environmental specialist to work with in certain areas, and identifying the roles that they can play and what they can do to be able to make my work easier and to make my work better, because we are all focused on improving health for humans, health for animals, and health for the environment. And so if we can work together, and I was thinking, it doesn't matter the kind of bridge it is, even if it's just a small wooden bridge, it's still a bridge, So at whatever level you start, that's still really important. You just need to take one step at a time. And so we need an integrated approach. That's what I'm talking about, like humans, animals, environmental. And I was telling Coco that one of the key weaknesses of our project is that we totally have not engaged the environmental aspect of it. We talk about One Health, but we've been so focused on the human and the veterinary that we haven't brought in the environmental aspect really well, which is something we just started the second phase, which is something that we're really thinking about as we go into this next phase, because we will not succeed alone until we are able to do that. Yeah. And so maybe some of the reasons why we do need an integrated approach: shrinking habitats. We talk about how we are encroaching on the animal environment and not the other way around, And so we are moving into habitats that humans did not inhabit before, and therefore a lot of exposure, a lot of new diseases are coming out, and we need to sort of take a step back and look at it differently. What's different? What's different with the current Ebola outbreak as opposed to other diseases that have been going on? Of course, pollution. That's your area, so I'm sure you know a lot about it. Also, our area, the things that are going on with pollution, the loss of biodiversity, climate change. It's a new thing that's coming up. We have to think about it. Because of climate change, now we have mosquitoes in areas where they're not supposed to be. We have so many different things happening. How do we then handle that? How do we take a step back and look at it and handle it? And of course, globalization and travel. That's so much at the forefront with the current Ebola outbreak that's sort of winding down. I just came back, I was telling Coco, so I just came back from a meeting. I sort of do this round the world trip because of my project. So I was in Uganda for a week, and then I was in Thailand for a week, and then I came back to the week. But in Thailand, we had a meeting of medical doctors. It's called the PMAC meeting. And there were all these medical doctors sitting in a room discussing human health. And I'm sitting there thinking, nobody is thinking about environmental health, and nobody is thinking about animal health. They're so focused on the human health aspect of it. And so we were discussing the Millennium Development Goals and talking about how the Millennium Development Goals did not succeed. So now they're coming up with what they're calling the Sustainable Development Goals for another 15 years. And they're coming back and saying, oh, we need to look at the social determinants of health, the environmental determinants of health, political determinants of health. I'm thinking, you should have thought about this 15 years ago, because this is so obvious, like some of these things are so obvious if you just take a step back and think about it. And so we just spent 15 years and they're saying, oh, we only succeeded 10% and spent how many billions of dollars trying to do these things, when if you just took a step back and said, who can I engage? at what level, when do I need to engage the community? When do I need to be able to engage different disciplines? Then you start from that point instead of doing it and then coming back to not be, taking a step back and thinking I should have done it better. I always tell the story of when I was growing up in Kenya, we had the DANIDA. DANIDA is a development agency that does the Danish International Development Agency. And so they came into our village and they decided they were going to build, the problem was water. We did not have water. You know, the women were going such a long distance to fetch water from the village. And Danida had such a great idea. It said, let's build water wells right in the middle of the village, you know. So they came in and they put up like 5 or 6 of them. Everywhere there was water, you know, and so the women could just go to those wells and pump water. And nobody was using the wells. The wells were right there in the middle of the village. Water was accessible, but nobody was using it. And so when they came back to do an analysis, they talked to everyone, and they were talked to the women and said, why aren't you using these wells? And the women said, well, we liked walking 30 minutes away to go get water because that's the only private time that we have, you know. And so we have that time. When you put it right in the middle of the village, you take away any extra time that we have, you know. And so if they just bothered to sort of talk to the women or engage them as stakeholders, because who fetches water? You don't build a water pump without consulting whoever is going to be using it, you know. So if they'd just taken a few moments to sort of find out who was going to be using it, then it would have saved them all this, because they had to now start relocating the water pump. So I think about that all the time, even as part of our project, because our stakeholders are really a big part of this. Of course, global trade in wildlife is another reason why we think about zoonosis and we think about One Health approach. Some of the reasons, of course, we want to be able to prevent and respond to disease outbreaks, reduce the risk of infectious disease, recognize and identify zoonosis, and build a One World, One Health. Sounds like such a big thing, but it's not. It's really just starting from the beginning. That's the way I look at it. Like, where do we start? If we can start just small, you know, then we can get to where we want to be. One Health concept, recognizing the interrelationship between the animal, the human, and environmental health. That's really key. If you can't recognize that, and most of the time the focus is on human disease, isn't it? We only panic when the outbreak happens in the humans. That's when everybody does, and by that time, it's too late. There's an outbreak and people are dying. I think about Ebola and maybe there's a bat or maybe there's a monkey, you know, engaged in that. Or even just rabies. You know, rabies will only happen because a dog bit someone. You know, if you start at controlling it in animals, it's not going to happen in humans. And other diseases, brucellosis, tuberculosis, a lot of these diseases that we think about, they happen because they've been passed on from some species, which if you control it there, you will be able to control it at a different level. I wanted to put this up. It's a very busy slide, but just to share that One Health is not just about infectious disease. It's a huge, there's so many things that it covers: conservation medicine, food safety, integrated system, land use production, agriculture, public health, communication, wildlife promotion. So it's just that we deal with a very narrow focus. We're dealing in infectious disease. That's because USAID just funded us to do that. So we have to deal with what the funding organization specifically targets. But One Health you can really take it and do anything you want with it. You need communication specialists in whatever you're doing. You want to be able to work with them. You need economists. You know, so you can find an economist working together with an environmental specialist, with a communication person. It's the multidisciplinarity of it, bringing together different people to work together to achieve the same aim. So just to talk a little bit about the USAID RESPOND project, this happened between 2009 and 2014, and the mandate was to strengthen training, educational programs, and support to governments and universities and civil society. Very broad mandate, but the main objective was to improve or to build the capacity of these, what they call hotspot nations, to respond to any emerging pandemic, like Ebola, like avian influenza, like the swine flu, whatever pandemic, like TB. Right now, TB is just exploded, and now it's multi-drug resistant TB. So if you can be able to build the areas they identified as hotspot areas where there's emergence and re-emergence of some of these diseases, if you could be able to just build their capacity to respond to these, then that's what USAID wanted. Emerging, so it's part of the USAID RESPOND project. It's part of what we call the Emerging Pandemics Threat Program at the bottom of the screen, the EPT program. And EPT had predict, it had respond, it had prevent, and identify. So 4 different programs. So predict is supposed to go out and do the laboratory part of it, and go out and collect samples, and sort of predict what's going to come, and then respond is the one that we are in, that is, okay, so who is supposed to be, who's going to be responding to this? What can we do with them? How do we build their capacity so that when something like this happens, we minimize risk? We can't eliminate risk, you all know that, but at least put them in a position to be able to respond and to effectively control it or manage it. And then we had prevent, that prevent mainly dealt at community level. Looking at the social, the cultural issues, what are those issues that actually can cause this, that increase risk? That, for example, in Ebola, if it's a funeral, a burial funeral, the fact, and I always go back to the gender, the gender part of it, because that's really a key part of me, because a lot of scientists forget that. They deal with all the other issues and forget that. Like the current, or the Ebola outbreak that's winding down in Liberia, 75% of the people who died are women. Why are they women? Because women are washing the dead bodies, women are cooking the food, women are taking care of the sick, and you can look at it from a health angle and say, let's just deal with the sick people or the people who are dying. But if you now begin to break it down on who's most affected, then you know who's most at risk. And what can you do? And I would think, like, one of the things I would do is just sort of focus on women and start training them and start giving them that opportunity. Say, you need to wear gloves, or you need to, but not necessarily looking at it from, not necessarily like taking away what they need to do, but working with them to be able to help them do that. So we were focused on improving the capacity, worked in 2 regions of the world, in Southeast Asia. In Southeast Asia, we worked in 4 countries, Thailand, Vietnam, Indonesia, and Malaysia. And in Africa, we worked in 6 countries, Kenya, Uganda, Tanzania, Rwanda, DRC, and Ethiopia. And those are still the same countries of focus up to now. Our objectives, I'll just flip through this, but the main thing was improve training. Provide them, build the capacity for them to be able to respond to any emerging pandemics. I put this in there because I figured if you need the slides, then you can read it up and follow it up. I want to say there are many partners, and to mention just who are the partners, the key partners. USAID was the donor agency. In Africa, we have what we call the One Health Central and Eastern Africa Network, or SEA. In Southeast Asia, we have the COHUN, Southeast Asia One Health Network. DAI is a development, Associates Inc., it's a development organization. They were the lead in the last RESPOND project. And then Tufts University and the University of Minnesota provided the technical. So we were doing all the technical work with DAI as the lead. We had 3 other groups, TFG, Ecology and Environment, and Africa Field and Epidemiology Network, that was smaller partners that we worked with at different levels. At Tufts University, although this program was housed at the veterinary school, the Cummings School of Veterinary Medicine, we ended up engaging a lot of the schools, a lot of the different schools, because we identified, I think over the past maybe 3 or 4 years, we had more than 50 faculty traveling from different schools being part of this project. So what the School of Medicine, School of Engineering, Education, Friedman School, Tufts Institute of Environment, the Sackler School of Graduate Biomedical Studies. So I was the technical lead for Africa. So what we do is we would when we set out a strategic plan with the One Health Center in East Africa, they identify areas of need, and this is based on them. We really stayed away from being top-down, like this is what we want. Even though USAID said we want to focus on improving the capacity to build for you to be able to respond to emerging pandemics, some countries had some really basic needs, and we're like, they're not going to focus on infectious disease control if even this need is not met. That is their need right now, and therefore we need to target that needs first, and we build it in as part of that program. And so some other task centers, the CELT, CTSI, TASK, and TIE were the centers. And in Africa, the One Health Center in East Africa is a network of 14 schools, 7 schools of veterinary medicine, and 7 schools of public health across the institution. And some of the public health schools are medical schools, so they're engaged with that. And some of the public health schools have the environmental program as part of that. And they are the One Health platform that we work through. These are the different schools, universities, 14 different institutions that we worked with across the 6 countries. So in Kenya, Uganda, Tanzania, Rwanda, DRC, so those are the different participating institutions. And what we wanted to do was we targeted 3 things. So one, our first thing is we were focused more on the institution, the university level, and saying, what is it that we can do at the university level to transform or to transition? Okay, this is the government level. Okay, so we were focused, let me start here, transitioning the current workforce. These are the people in the field. We thought about it like, okay, we work with governments, we work with civil society, we work with non-governmental organizations. How do we transform that current workforce that's out there so that they're able to respond to this? So taking the agriculture people, medical doctors who are out in the field, pharmacists, what kind of training can we provide so that they're able to respond to any outbreak? So that was the first step. Then we thought, how about the students on campus? Because all the students who are in college now are going to graduate over the next 1 to 100 years. And if we can transform the way they are thinking to start thinking in a One Health manner, then we have people out there that already have the concepts of One Health and are already ready to work with other disciplines to work together with them. So this was actually our main focus because we were university focused. So we focused a lot on how do we then take the current students on campus so that by the time they graduate throughout, they're able to do this. And one thing that we know is that the students on campus, I was telling my students in Kenya, because I do a lot of cross-teaching across, I said, I would tell them, you know what? The next president of Kenya is sitting somewhere in this university. That's true. The next director of medical services, the next director of agriculture, all the leaders are sitting somewhere in these institutions. And so if we can get these concepts into them at this level, by the time they graduate and come out, they're going to know about it. They're not going, if they see a medical doctor, even if they are in agriculture, they'll know how they need to work together with them. And one other thing that we wanted to do is sort of get into the community. So we are working at government level, we are working at university level, and also how do we work with the communities so that we're not just going into the community, collecting research, doing research and then leaving. Because that's such a common thing. People just go and say, I'm going to do research in the community. And the communities are so tired of all these researchers just coming in, collecting data, and then of course publishing. It's good to publish, but no one in the community is ever going to read your paper, They don't. So how do we then engage them in such a way that when we are working with them, we do interventions with them. We identify what they think is the big issue, and in the process, develop an intervention strategy and work together with them. As you're doing your research, you're also doing interventions with the community as part of your team. So those were our 3 main objectives. We thought, before we started, For any program, any good program, even your environmental studies program, our veterinary medicine program, you must have competencies, isn't it? You must have competencies and you must have skills. What are those skills that people need to come out with? What are the competencies that defines a One Health person? So what we did is we worked both across Africa and across Southeast Asia with the countries for them to come up with what they thought were their main competencies. That's where we started in the beginning. And so we had the global One Health core competencies. We had Southeast Asia develop their competencies. We had One Health Central and East Africa get together and develop their competencies, saying, okay, if we think we want you to graduate from college, these are the skills and competencies that we want you to be able to have so that you can work well with other people and you can be called a One Health person. You know, if you have these competencies, then we know that you'll be able to have the skills that you need to be able to work effectively with other people. And like I say, I was very proud of Africa because we're the only ones who came up with gender. The rest of the world doesn't think it's that important. Yet it's really, really important, yeah. And also research, they thought research is really, really important for you to be able to train anyone in One Health, publishing, research, doing research in all these areas. So I'll just briefly go through some of the things that we did as part of this. We did a lot of things. I just singled out a few things. Looking at curriculum. What curriculum is offered at the different schools? At the veterinary school, is there anything that's related to One Health? And so working at the medical school, do they do anything related to One Health? So working with the curriculum departments with different disciplines to say, how can we work with you to review your curriculum? How can we work with you to sort of review your curriculum and start integrating this One Health competencies into those curriculum? How do we bring in leadership skills? How do we bring in collaboration skills into your particular program? And knowing people, the programs are already packed with a lot of stuff. You know, like it's really not easy to bring in an extra course in your program probably. And so what we were thinking is, how do we do this? Maybe just using a case study, using digital storytelling, something that you can do in a class in 20 minutes or 10 minutes or something like that. Keep integrating. How do you, maybe just developing a case study related to culture. You already have environmental case studies, but integrating culture into that case study, integrating leadership into that case study. So we worked on a lot of case studies that they can use, that they could use. One of the things that we also did, we thought was really important, was to build a cohort, a team of people that we thought they can come out, they can graduate with these competencies, go out there and actually be called multidisciplinary or One Health specialists. So we worked with Makerere University to develop a master's program in veterinary preventive medicine with a focus on field epidemiology. So this is a 2-year program. They spend 75% of the time out in the field. They do work on outbreak response. They're working on different outbreaks that are happening, doing risk analysis, doing all these skills in different ways. And then they're posted to go back and work with their governments. So the current program has 12 students from the 6 OSEA countries, 2 students from each country. Training, they're just about to graduate. They graduate in May. We are taking in another cohort of 12 starting in September to just do this. And the good thing about this program is the first and second cohorts were funded by OSEA. Now we have other donor agencies coming out, and that's what we want. Well, we have students who are enrolled as private students. They're interested in the program. They want to pay. We have NGOs that are willing to fund their students to do this. And so we have the Norwegian agency, I think, just came up and said they're willing to fund 9 master students and 6 PhD students over the next 5 years. So it's very exciting watching it grow from just being a USAID program to other people being interested. And basically that's what we want. I think that's one other thing that we wanted out of this. If you're able to build these linkages, then the organizations, OSEA and Siohun, can stand up on their own, or these universities can be able to reach out to other agencies and get funding or do their own thing, generate their own funding in different ways. One of the things we thought about is doing what we call One Health demonstration sites. So these are very community-based. So we identified areas in 3 different countries, Uganda, Tanzania, and DRC, Democratic Republic of Congo, where we felt there were multiple One Health issues. Like in Tanzania, I can give you an example. It's an area that's close to the Mikumi National Park, so there's wildlife, human interactions. There's a lot of pastoralists in this area. There are sedentary farmers. Human, wildlife, human conflict is really big. We have a lot of tourism and traffic going through, pollution. We have a lot of people invading their community from outside communities. We have displacement. They had floods a few years ago, and so all the people were displaced, and some people are still in displacement camps. Their animals died. A lot of them lost their animals, and there was no plan. When the floods happened, the humans were taken to safety. The animals just drowned, you know. So things like those, and animals that were their livelihood. So a lot of them ended up in this area. So we identified these areas that we call demonstration sites, where we can have students from the university, faculty from the university, we can have government people, and we can have the community. Like you go in and identify, hey, we have human-wildlife conflict. How do you want to handle it? So the community comes up and says, we want to develop like management, a wildlife management association, and they work together with the faculty, and they work together with the government and the wildlife, you know, like if in Tanzania, it's TANAPA, the Tanzania National Parks Association, working together with them and saying, we have elephants coming in and destroying our crops. Maybe if we have beehives, you know, the bees usually are known to chase away the elephants. We can benefit from them by selling honey, and at the same time, we cannot have elephants. So the community participates in that. So this is very community-focused, the One Health demonstration site that actually most of the time community-driven, that communities identify their problems. So these are the key areas we want you to help us address. And we try to be very, very, not think in terms of huge, huge projects, just small-scale, community-based. What can we achieve? What's the low-hanging fruit? What can we achieve right now that will change your life? You know, what do you want to do that will become sustainable? You will continue to do it even after we are gone, you know, things like that. That's really our main target. And of course, this is the One Health demonstration site. One of the things we did is engage a lot of the students. So the students are going out together, the medical students, veterinary students, environmental students. We've established what they call One Health clubs. And I think we have those at Tufts now, a One Health Students Club, where the students are going out, working together, and saying the medical doctors are educating the community on rabies. The vets are treating their dogs, you know, and giving, you know, so that it's a collaborative effort, doing it together. And this is the One Health Students Club. So one of the things that we did actually is we do have a club at the vet school, at our vet school, a One Health Student Club at the vet school. And we linked up our One Health Student Club at the vet school with the One Health Students Club in Rwanda. And so they started sort of working together. They have this website where they're supposed to share like cases. And over the summer, we had some of our students traveling over there and doing their research projects. They applied for NIH funding, which is something that, or different kinds of funding, got here, went out to Rwanda and worked together with the students there to go out into the community and do some projects. So just a lot of the things that we've been doing, like I said, some places it's just basic. The faculty just say, we just want research design skills. I don't know how to write a proposal. I don't know how to write a manuscript. That's their primary key. And we are working with faculty, so we cannot just say, no, we will forget about, we're just going to train you to respond to an emerging pandemic. No, we have to take what they want to do and build it into the program. So we did a lot of that, of working together with faculty to just submit a proposal. We've submitted a lot of GATES, you know, exploratory proposals with them. Some of them are funded. We get so excited. Some of them are not. You know how it is with writing proposals. But they gain that skill. They gain, you know, they know how to do it. Just even poster design. Some people would just say, okay, I want to go to a conference. I'm supposed to present a poster. These are things you take for granted, but they don't know how to do it. So if I can be able to spend an hour working with faculty just to show how do you do poster design. How do you prepare a PowerPoint presentation? Some of these things are really, really important for people. And so just understanding where everyone is. And working in 6 different countries, they're all at different levels. I can tell you that it's really, really, every country is at a different level from the other one. So you cannot just take a blanket thing and apply to all of them. We had a lot of faculty exchange back and forth. We had faculty coming in from Africa. We had our faculty going out to work with people in Africa, in different countries, in infectious disease, in research design, in task. One of the things that we do in the health sciences, I don't know if you use it, but we in the health sciences use the task. The Tufts University Science Knowledge Base, which is our platform, our course platform. And one of the things that we like about TASK is, even though I'm at the vet school, I can access the medical school work. If I'm teaching histology, histology is probably the same in medical school and in dental school. And so if someone teaching histology at the medical school has some really, really good histology slides, with TASK, I just click medical school, put in histology, and I'll be able to have access to their material. And so this idea of you can link up different schools. And we worked with the University of Pretoria in South Africa, which is open source. They have access to, it's one of the top vet schools in the world. They have access, they've provided access to all their materials. They download it, take it as much as you need. So we worked with them to be able to access that material and to provide it to the institutions that we were working with, because it's really difficult to get good teaching material there. So we had a lot of faculty going out and doing different things. We worked with them to develop a lot of short courses, needs assessment, risk analysis was a big thing, doing risk analysis, gender in One Health, participatory epidemiology, participatory impact assessment, outbreak investigation. Outbreak investigation was our big thing, One Health leadership, and we worked with Southeast Asia and Africa to develop what we're calling One Health problem-based planning casebook that they can use, and other people can borrow from that. That's TASK, our knowledge base, as I talked about it, installed. We have some offshoots of this program as part of, because we did this with Rwanda, one of the things we identified was that the University of Rwanda Vet School were graduating students without ever touching an animal. So you have vets who are graduating, but they've never been out on ambulatory. They've really not touched a cow, or a goat or anything, because they don't have they can't go out to the field. They don't have a vehicle to go out there, And USAID was not buying vehicles. And so we thought, you know what, let's work together and develop a proposal and submit to someone else who can be able to fund us to get a vehicle. And so we did get the Cummings Foundation, which funds the veterinary school a lot, agreed to put in like $200,000, and they gave us this money. They accepted our proposal, and they funded the ambulatory clinic. So we have the ambulatory clinic running now. We have vet students actually going out into the field. So that's really like a very practical. So we know we're actually building the capacity, because a vet is not a vet if they've never touched an animal, You don't want to be giving your animal to them to take care of it, So, and we have another program called the Taluas Network. Is supporting another program, the YEPI. It's a grant to 4 schools, Kenya, Uganda, Rwanda, and Tanzania, to sort of build the what are they called? Economic skills, those skills that business skills of graduating students, so that if they want to go into private practice, they have skills that they can be able to start their own veterinary clinic or start their own practice or something like that. So some of the lessons learned: it's difficult to work in an interdisciplinary manner. We talk about it, but it's so hard, especially, just look at us, we're the vet school. It's so hard to get to Medford, especially when you have 3 feet of snow on the ground. And sometimes we depend on web-based connections. But think about it in Africa, it's even harder, It's a lot easier here, but we're not doing it. So it's really hard. And then people are so siloed. Veterinarians just think of animals. The human doctors just think of humans. Environmentalists just think of protecting the environment. And that link of working together, it's so much easier to say, hey, let's work in a One Health manner than it is to do it. I can tell you we had a lot of issues, maybe not we were able to work with them, just working with another university, you know, on this project, just saying University of Minnesota and Tufts, how do we, as two different universities with different ways of doing things, work together as a team to implement this project? And of course, creating an environment that supports interdisciplinary inquiry is also difficult. I think this is one of the things that Tufts is doing really well at. I would say that a lot of the things that are coming out, they're saying, Tufts Institute of Innovation, let's have multidisciplinary groups working together. A lot of the things they're trying to encourage that. So I think Tufts is making a big stride towards that. And of course, not every topic can be interdisciplinary. You can try, but you have to also use common sense. There's some things that might not be, there's some things that are easy to do. So. And of course, university logistics. Every university has its own different logistics, the way they do things, the way, and so just sort of bringing those together to work together, it's very, very hard. But I can seriously say that the fruits, just watching what has happened over the past 5 years, seeing where we are, maybe if I look at it in the big picture, we didn't make that much progress, but I think we did. I think just right now we don't even have to say what's One Health. Everybody knows what One Health is. Everybody sort of has an idea. They have these. I was very excited when the team from Rwanda just sent me some proposals and said, we've applied for these grants. Because I'm like 2 years ago, they would not have done that. You know, so those are some of the things that are really, really exciting to do. We have new funding. We have another 5 years of funding, so I have a job. Which is really good. It's called the One Health Workforce. EPT2, Emerging Pandemic Threat 2. And out of this, we still have Predict. We have One Health Workforce, and we have Prepare. And so our One Health Workforce is just focused on the universities. How do we build the capacity of students still at university and their faculty to go out there by the time they graduate to be able to respond to this? And these are the partners that we worked with, and I just want to acknowledge them, the work they've put in. It's really been great working with them, and we are looking forward to another 5 years. That's our infectious disease and global health department at the vet school. Thank you. Yes. I'll take questions if you have it. Yes.
So how do you work with individual faculty in African countries? You said you revise your curriculum. How do you reach out to individual faculty or engage them to implement your case studies or change, integrate One Health somehow in their classes?
Okay, so the question is, how do you work with individual faculty to get them to integrate One Health into their courses? So what we did is, usually it's so much easier to go through the authority at the school, like the deans of the different schools. The deans of the schools sit on the OSEA board. And each country has what we call a focal person at the university. So they have the dean, and then they have the focal person who sort of works with the other faculty to identify. And when they identify their plan, like now we just did a plan for this year, what are the activities? It's not just one person doing it. They have a team of faculty who sit down and say, we have this much money coming in from USAID. These are going to be our priorities for the next 1 year. This is what we want to do. So then they identify that. So when they say we want to review the curriculum, in a lot of the schools where we've done this, their curriculum, you have to review your curriculum every so often. You know, you have to review your veterinary curriculum every 5 years or every 10 years. And so some of the schools were due to review their curriculum. Some of the schools forgot that rule, that regulation, that they're supposed to review their curriculum. So when we worked with them, they're like, oh yeah, we're supposed to review our curriculum. We have money, we can actually do that. You know, they got funding to be able to do that. So that's one of the things that we did. Those that were ready to be able to review their curriculum, we worked with them to do that. But others, faculty are really interested in course design. So working with the CELT, the Center for Education, and with Donna Qualters, actually, she worked with a lot of the faculty to do, would say, let's have a workshop. And in this workshop, you're going to redesign your course, you know, and you bring them together for 1 week and you work with them. You have, I know that many times we'd have over 30 faculty in a room, and that week you just work with them to redesign their course. Redesign their course, develop objectives, develop plans, develop activities for their course. And when you're doing that, you now integrate competencies into them. And then we had them, as we're training them, we have, one of the requirements was that they must upload their course onto Task, if they have Task. So they don't call it Task. Makerere calls it Mask. You know, so every country has its own different, it's just the science knowledge, but they have their own different name. But that was a requirement because the students must have access to that material, you know. And that was one big thing, because students did not have access, because they're not using online, they're not using a course management system. So a faculty can just come in with handwritten material, and maybe it's just on his little laptop, you know, and the students don't have access to it. But now putting it on Mask, students can be reading it at midnight or whatever time they want it. So that was one way that we did it, just doing the course design with them, working with groups of faculty, but having it come from them. Because if you want them to implement it, it must be their idea. Yeah. Thank you. Are we planning on increasing to other countries? Is that the question? So yes, with the Ebola outbreak in West Africa, that was very, very obvious that, you know, it really made, actually USAID the past 6 months literally lived in West Africa, you know. And one of the things we thought, we had an Ebola outbreak in Uganda in 2010. And we had an Ebola outbreak in Uganda in 2012. So the 2012 outbreak, the Ebola was contained within 26 days. You know, and we were really proud of it, because we thought this is what we were in there to do. You know, this is what we've been working on, saying when you have an outbreak, who's in charge? Who's supposed to respond? Who can you bring in? What do you need to do? How do you need to communicate with the community? What needs to be done? And so we were very excited that they were right on top of it. You know, they were right on top of it when the second outbreak, when the 2012 outbreak happened, contained within a very short period of time, very few, I think there were 14 deaths. And I'm sorry to say that 11 of them were women, you know, so still like a really, bad thing there, because nobody thinks about the gender issues that cause some of these things, but just the way they responded. And then we've had, during the Ebola outbreak in West Africa, Uganda sent in teams, Tanzania sent in teams of people that we'd worked with to train. You know, they were sending all these people who, we know how to do outbreak response. Let's go into Liberia, let's go into Sierra Leone. And that for us is a big thing, because you just don't want Americans and Swedish and all these people coming in. You want the Africans themselves to be able to say, how do we then respond to this? It's in our world, you know. And so we're thinking of expanding slowly to these other areas where we can, depending on funding. One of the things that was a massive failure, I think, I wouldn't call it massive failure, but it didn't work, is because we were not able to predict. You see, that's the whole thing. We're not able to predict that outbreak was going to happen in that area, which is one of the things that we want to be able, we call it hotspots, you know, and so we should be able to say, hey, there's a very high chance that this could happen in this. And that's one thing that we are working on. Sometimes, of course, you can't predict. You're not able to, but just working on that to see if we can be able to improve that aspect. I can tell you that there are many things that went wrong with our project. There are many things that went right, so it's not all rosy. I'm just presenting the rosy picture. But I can tell you that looking at it, I'm glad that we did what we did. It's a really big step forward, and people have really benefited, and you can see it when you work with the communities, when you work with the universities. They're at a completely different level from when we started. Yeah. Yes. Okay, so I'll try to summarize the question for the sake of the people who are listening. How do you deal with the cultural issues, and are they aware of these cultural issues, or is it a complete maybe lack of awareness? And maybe how have we dealt with it in our situation? I think so. I'm a social cultural specialist. That's one of the areas, one of my areas of specialty. And one of the things that I think I've learned through this process is a lot of the times when we go into a community, we go in with the idea of we want to change that community. These are the good medical practices. Therefore, take them. And it was like, for example, when not necessarily just medical, anything. Oh, stop cutting trees because you're killing the environment. But we don't realize that sometimes it's a choice. Someone has to decide, am I going to put food on the table for my children, or am I going to stop cutting a tree? So if I'm given that choice, if I have no firewood to cook, and someone is telling me about environmental issues, I'm sorry, I'm not going to be listening to them. I'm going to cook and I'm going to feed my children. So I think that sometimes, especially with development people, we go into a community and we know that it's wrong. This is being spread by, and I think that was very evident in this Ebola outbreak. It was very evident because health workers went in and they said, we are cremating the bodies. We're not. This has to stop. You cannot touch the body. You cannot do this. Therefore, we're going to cremate bodies. And health workers died. They were killed in this outbreak. The communities just reacted. And I thought about it in the sense of you're dealing with a community, and I can give you an example. Being African, I sort of can be able to associate with that, where I'm not going to let you take my dead mother away. Period. It's not negotiable. Like my mom has died. This is the routine. I need to clean her. I don't care if I'm going to die. Sometimes it's that mentality. And so I think it's an issue of understanding what can we do so that they can still be able to do what they need to do respectfully, because that person really is going through a lot of trauma. I mean, it's not like they're just saying, oh, I'll forget about the health practice. They're losing people. People lost their whole families. They're losing people left, right, and center. It's very, very traumatic. And so being able to say, what can we do so that you can do your cultural thing in a safe manner? And I think eventually they stepped back and did that. And this happened in 2002 in the Ebola Gabon outbreak. There was an outbreak in Gabon in 2002. There was an outbreak in Cameroon in 2005. Health workers were being killed, and in 2015, health workers are being killed. So I feel like to some extent we're not learning much from what happened in the past and taking a step back and saying, this is the cultural issue. This is the community, the way they want to do it. They've done it a lot well now. They're saying, okay, you must bury your dead, but you can disinfect yourself. You can wear gloves. You can be able to do 1, 2, 3 and still bury your dead in a nice, decent way, the way you think. Because some of the things that people's values are different. I value burying my mother, more than my life even. Sometimes, you think about that, like she'll haunt me for the rest of my life. That's what people think sometimes, So it is important to think, to be able to understand. And I think for me, that's usually the big thing. When you work with scientists, a lot of scientists are very focused on the science. And they don't realize that science is just like one part of, they're the social determinants. They're the cultural things that make it successful. You can discover a vaccine, but if people don't want to vaccinate their children, it's not going to succeed, So you have to think outside the science. And that's where, I guess, to me, One Health comes in. Bring in an anthropologist. Bring in a social scientist who understands this community, who is able to do something to them. I was watching one of the videos where I think there was an outbreak of hantavirus in the Navajo in 1993. And all these health workers arrived in the Navajo residence, and they wanted to know, they wanted to talk to the people, they wanted to collect samples, and they would walk in and the people would just close the doors, you know, behind them. And nobody realized until much later that the Navajo people, they mourn for 4 days. They will not, if they've lost someone, they will not talk to anyone for 4 days during that mourning period. But these health workers were just going in, and that was such an affront to these people. Like, how do you not even respect this, that we are in mourning? Just give us a few days to mourn our people who have died in this. And so I think it's really important that we work with the people who know. We work with the qualified people who know, and bring them in at the beginning. Don't bring them in when everything is going bust. Yes. Okay. I don't know if that helps, but at least, yes.
Yes, environmental is important, and that's important, but like we need to deal with human things now. Or like you said, when USAID says focus on infectious disease, but you go into the community and find out that they have this underlying basic problem, you're like, we got to take care of this first. So how do those negotiations work when you're trying to make plans and trying to put money into different things? Is there a system for compromising? Is it really difficult? Do you find that there's things lost along the way? Or how do you work with those different actors?
Okay, so the question is, with so many different interests and priorities, how do you work together with them to be able to like achieve what you want to do? And one of the things I can say is that our goals really help, and our objectives, you know, because we set out, we say, this is a USAID project, and the objective is to build the capacity of your country to be able to respond to any emerging pandemic. And so when you have medical doctors and you have veterinarians, you have environmentalists sitting together, we say, this is our objective. This is our end point. We need you to figure out a way of getting to this end point. And people have different ways. And so we respect that. But the countries went about it differently. The countries would sit together with their teams and say, this is how we want to get to this end point. But we kept that end point in mind. And some of the countries said, you cannot train our students without a platform. See, we need a course platform to be able to even just train the students. So we linked that to our objective and said, okay, if we need to attain this end goal or this end objective, we must be able to provide a platform. In one country, we actually had to put in internet. We had to get funds to do fiber optics for them because they're not going to communicate with anybody. This is the University of Rwanda in Nyagatare. They're out there, right out there in the village. They're not communicating with anybody. They're not doing anything. How will they respond to any outbreak if they cannot even communicate with anybody? That's our priority. So step by step. So that's why I was saying different countries are at different levels. It doesn't come without conflict. Of course, there's conflict. There are powerful people and there are less powerful people, and everybody wants. But as long as we kept the objective in mind, this is our end goal, this is where we want to get to. And if you're working towards that, that's good enough for us. Yeah. And we also, like I said, we also identify those things that we were calling low-hanging fruits. We can do it right away and achieve. And we have our long-term goals. This will not, the students that are coming out of the schools, we won't be able to assess what they're doing until 5, 10 years from now, you know, so we don't know. That's a long-term goal. How will we know that we actually trained one health specialist? We have to go back 5, 10 years from now and do an assessment and talk to their employers and talk to other clients and follow up on them. Yeah. Okay. Well, thank you. Thank you. And I'm at the vet school. If you need send me an email or more information, definitely I'm willing to provide some more information, plus the whole team of people. And like I said, we really hope this is an opportunity to sort of begin to engage the environmental. As you can see, it's very focused on human and animal health, isn't it? Yeah. So,
a lot of students here are from the community health program as well.
Yes.
So one of the questions that I might just pose to you really quickly is, to what extent are there opportunities for our students to get involved in the work in Africa or Southeast Asia? Are there summer internships or things like that that they could approach you about?
We're just starting the second phase, but I think there'll be such opportunities. Yeah, I think if they could approach, if they could send an email or find out, sometimes even if it's not, maybe we might not have funding, but they can be my research assistant or something like that. Link them up to a group that's working, you know, yeah. Because we've been doing that with our students. Sometimes we don't have funding in our project, but we can be able to say, hey, we have this work that we're doing in Tanzania, and we know so-and-so who's doing it, and they can be able to fund a student or something, yeah. Okay, okay, thank you. Okay.